ahead and create an account with the National Registry. You're going to need to have one of these. But before you do this, I want you to make sure that you're going to have your identification, your driver's license, or a birth certificate. You want to use the exact name that it says on these legal documents. You also want to have your address that you're going to be having mail sent to, not somewhere that you're temporarily living or visiting, a permanent address where mail gets sent to. You're going to want to also have a permanent email account and a password. So as you create this account, we'll go over here to create an account. It's going to ask you for all this information. And as you fill out the information, it's basically going to be about who you are, your address, your phone number, your contact information. And as you go through it, it'll also complete that. Now, once you complete your site, it'll look a little different as I sign into mines. Okay. Let's see one more time here. There you go. Okay, so we're logged in, and you saw even if I knew my own password, it took a little while for me to get logged in. But this is what you're going to see, candidate. And as you get this candidate role, you would have filled all your profile in with the name, address, phone number, and all of that good stuff. But you want to look at, you want to later on to go back so you're a candidate. And what you want to do is go to your applications here. So I changed that around again. You get your name. It'll show your name here, large name here. It'll have some information. You won't have this here. It'll be blank. And what you want to do is go back down to applications. During this site, you're going to create an application. When you create the application, you're going to verify that it's your information, and you're going to continue going down through all of these questions as it goes next, 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 next. And up here, it's going to tell you about, it'll continue to open up. It's going to ask you about your program, the date that you graduated. It's going to ask you to choose and select the site of the college, and you'll be looking at either if you're with Kapiolani Community College, and the program director be Jeff Zuckernick. If you are with Hawaii Community College, your program director would be Jack Manassian, and if you're with Honolulu Community College, your program director would be John Kanaulu. As you complete this, it's basically going to have application, and you want to then later on check your application status. And here it would show the application for your EMT. Right now, I have no application standing, so it would not say anything. But once you complete that, it would basically say, hey, your application's on hold because the program director needs to verify that you've completed the course, number one. And then number two, you'd have to pass the skill testing. Now, passing the skill testing does not preclude you from taking the written exam, just having them sign off. So, the program director signing off that you completed the course and you took your final exam and passed that for the course that you have attended. Again, this is only one way to get your national registry. You have to pass that course. Once that application status has been changed, you'll find that this results changed and you're able to take it. Here you see in this case, I did sign up way back in the day before this King Initiative. I applied to take the test. I took it, scored, and passed. And it shows you your summary here as well as how well you did. Now, then I'm supposed to go ahead and locate a psychomotor exam. You don't have to worry about that because your program, if it's Hawaii Community College, Honolulu Community College, or Kapiolani Community College, you'll be taking a psychomotor test with your training site. At your training site, they may ask for a third party tester to come in as we try not to create these types of issues in personality conflicts or bias. So in some cases, I won't skill test my students. However, I feel like I have no conflict of interest at all. I feel I'm pretty hard tester, but if there is a conflict of interest, that should be brought up, and your skills testers would limit your testing that way. Again, now the psychomotor test, when you take the psychomotor, we're going to be doing the airway. We're going to, the apneic patient, you're going to be oxygen administration. You'll be doing the SCEDS, that's the seated supine and the longboard supine C-spine patient. You'll be doing your medical and trauma assessment. You'll be doing the CPR AED. You'll be doing the joint immobilization. You'll also be doing the hemorrhage control and shock, as well as long bone immobilization. So we do all of them, and we see how we do as far as results. All right, so let's go ahead and make sure that you understand you're going to create this account. Once you create this account, you'll be a candidate. Then you go ahead and apply. You'll create an application. You'll follow these steps. You'll make sure you sign up for the right college or training site with the correct graduation date and a valid CPR card that needs to be valid throughout that time before you get your certification. You'll wait in this holding pattern until your program director signs off that you've passed their course. Then it'll allow you to take the written test. Your psychomotor testing can be completed at your training site when they schedule that date. All right, we'll go ahead and take questions now.